Hey everybody. So I was thinking about what I wanted to mention for the next DBT tip. And this is something that came up just last week where I had a client who told me that she logged off the computer during group. And I asked if any of the clinicians had followed up with her, and she said that they did not. Now, there were a couple of reasons why I think that they did not. There was a lot of transition going on in the group, and I think both of the group leaders were fairly new and just getting to know this client. However, it made me think about an old guideline that was passed down to me back when I worked in community mental health. The guideline was that if somebody left the group, that we would never follow them, we would never chase them, and it was because we wanted to make sure that we weren't reinforcing the behavior of leaving and then someone coming after you, which makes total sense. Now, the problem with that is it depends on what it is, what behavior you're trying to potentially extinguish or grow and therefore reinforce. And so if the client has a target around passivity, maybe active passivity, and they have a pattern of behavior that showed up as problematic, and you guys have agreed to target the behavior for that reason, then it would make sense that if the person left the group or if they left the session or if they hung up on you, that you wouldn't then call back because you'd be reinforcing the passivity. Now, this client in particular, has a really hard time with emotions. And so her highest target is actually exposure to emotions. And so let's think about what happens when the client logs off of their Zoom, or they walk out of the room, or they just stop session and they leave and they go get in their car. Now, what are you reinforcing? So if the behavior that happened was leaving, then what is stopping? Well, experiencing the emotion is stopping, right? And so somebody that's not paying attention to that might think, oh, that person's leaving and I don't want to reinforce their passivity. But what if that's not their primary target? What if it's not even a target for them at all? So it's really important to stop and step back and have the bigger picture of the case conceptualization, even in these tiny, tiny moments that happen between you and your client in session. Like if they hang up the phone, are you going to call back or not? If it's still, in the middle of session, I said phone, computer, whatever it is. In that case, for the client that left group, she left group because the emotions were really hard and talking about the content was really difficult. So if exposure is the treatment method that I'm using, or if it's the intervention or the set of change procedures that I'm using, I'm actually going to want to make sure that I block her attempts to escape, which means I will call her back. I will run after her. I'm not going to show up to her house, but like you get the point here, right? So I want you to be thinking about when you have this saying or the statement of we don't want to reinforce, ask yourself exactly what you might be reinforcing. And is that actually a part of the client's full conceptualization? Does it relate to their clinical picture? I hope this was helpful. Let me know what you're thinking. Take care.